Financing and Reimbursement Methods by Professor Tammy.
Financing and Reimbursement Methods, Part 3. Public insurance. Government financing. So, how is government putting money in the public health insurance? According to the 2013 statistics, a little over 1/3 of the insured, those who are insured, are covered under public programs, public health insurances. 17% covered by Medicaid, 16% covered by Medicare. Categorical programs. The benefits are designed for defined categories of people. Public financing. Medicare, Title 18 of Social Security Act. Medicare is an entitlement program. You deserve to have it. You are entitled to have it. People contribute their taxes over the years while they're working and are entitled regardless of your income and access, whether you own a big mansion or you live in a small apartment, or if you have millions and millions of dollars or you're in debt, you are entitled. You can have Medicare. It is a federal program administered by CMS, Centers for Medicare and Medicaid Services, which is an agency under the U.S. Department of Health and Human Services, also known as DHHS. Finances medical care for those who are 65 years or older, disabled people who are entitled to Social Security benefits, and those with end-stage renal disease. That's the end-stage kidney disease. Medicare is not a comprehensive coverage. The main non-covered services that they do not cover is vision, eyeglasses, dental care, hearing aids, many long-term care services. Then you have something called Medigap. It is a private insurance used to cover gaps in Medicare. There are 4 parts to Medicare: Parts A, B, C, and D. Public financing. Medicare Part A deals with hospital insurance, financed by payroll taxes, paid by all working individuals, paid on all income earned, paid equally by both employer and employee. The hospital insurance covers inpatient services, short-term convalescence and rehabilitation in skilled nursing facility, also known as SNF. Home health, hospice, that's the end of life. Like usually you will be passing away 6 months or less. Hospital insurance expenditures. And if you look at figure 6.3, you'll see that Medicare Part A expenditures is mostly from hospitals. It's almost 50% in 2015. So it was 49.9. Managed care is about 28.2. Skilled nursing facility is about 10.7, and the rest being administration, hospice, home health. Medicare Part A, remember that's the hospital portion. Timing of benefits is determined by a benefit period. It begins on the day a beneficiary is hospitalized, so that will be day 1. It ends when the beneficiary has not been in a hospital or a skilled nursing facility for 60 consecutive days. That means 60 days in a row. Therefore, a new benefit period begins. A beneficiary can have unlimited benefit periods. Hospital benefits. Deductible is paid for the first 60 days. So if you continue staying at the hospital, the co-payment required for 61 to 90 days starts. And then a higher co-payment is required after you're still in the hospital after 90 days, and reserve days must be used. Skilled Nursing Facility, SNF benefits. Eligibility begins after 3 consecutive days of hospital stay. That means 3 days in a row. And 100 days maximum to be in a skilled nursing facility. The first 20 days at no charge to the beneficiary. That means you don't need to pay. Co-payments applies starting from day 21. So if you're still there on the 21st day, you got to start paying. Home health benefit. Patient must be homebound. That means they can't really go anywhere. They have to stay at home. Patient must require intermittent or part-time skilled nursing care or rehabilitation care. Hospice benefit. Patient must be terminally ill. That means they are so sick. Only a token co-payment is required. And usually when you go to hospice care, you usually have 6 months or less to live. Medicare Part B, Supplementary Medical Insurance, SMI. It covers such things as physician services, hospital outpatient services, such as surgery, diagnostic tests, radiology. So think about it. Part B is more like seeing your doctor. Part A is the hospital. Part B is the doctor or the health staff. Medicare Part B covers certain screening and preventive services. Annual wellness exam, that's like your annual checkup. For most services, there is an annual deductible, such as 80-20 ratio kind of co-insurance. Medicare Part C, Medicare Advantage. The beneficiaries are given the choice to remain in the original fee-for-service program or sign up for Part C. Additional benefits like basic vision and dental may be offered by the private managed care plans. Beneficiary receives all Part A, B, and D services through the MCO, the Managed Care Organizations. Medicare Part C eliminates the need for Medigap coverage. Medicare Part D, prescription drug coverage. It's created under the Medicare Prescription Drug Improvement and Modernization Act, MMA, of 2003. Available to those who have Part A or Part B. So, if you have Part A or Part B of Medicare, Part D is available for you. Monthly premium must be paid for Part D. Annual deductible also applies. There are 3 layers based on spending. So if you see Table 6.1, hospital days of stay and costs for a given DRG, page 146. So when you look at day 1, it's 1,200. Day 2 is 900. Day 3 is 700. Day 4 is 600. You notice as you are there in the hospital for more days, it is less per day. Day 5 is 600 and day 6 is 600. So it seems to stabilize there for now, for these 6 days. So if you only stay in the hospital for 3 days, you have to pay 1,200 and 900 plus 700. But if you stay for all 6 days, then you have to pay for all those prices I mentioned. And I just want to let you know that this is all based on how much they know that's being spent in the hospital each day that you are there. They have some kind of analysis based on past bills that were given to them and that they paid. I meant the health insurance and also the hospitals. And just to remind you, let's go over. Medicare Part A is the hospital. Think of something big. It's the hospital. Medicare Part B, there are doctors in the hospital. Medicare Part C, vision and dental, which is optional. So you're seeing they're the other doctors. Medicare Part D, it is your prescription. So hospital, doctor, then vision and dental, then prescription. Medicaid, Title 19 of Social Security Act, finances health care for the indigent, but it is a means-tested program. So it is what you need kind of program. Jointly financed by state and federal government. So the federal government gives the money to the state based on how many people in their state have this income bracket, and that's how much money the state gets. And from there, the state kind of distributes it. Each state establishes its own eligibility criteria according to the income and assets. So when you think about New York income and the needs, how much we need to pay for our bills, it's very different from, I guess, Louisiana or even Wisconsin or Idaho or even Alaska and Hawaii. Each state administers its own Medicaid program. So if you look at Figure 6.4, Medicaid recipient categories, page 141. And just to let you know, Chip, also known as Children's Health Insurance Program, is part of the Medicaid program. In some states, they might just put the kids in with Medicaid. In some states, kind of have a separate program called Children's Health Insurance Program or a similar name to it.
See you soon. And remember to read the book.